get it.
Hello to those of you who've already said hi in the chat box. Welcome to the webinar, everyone. We are due to start at 4 o'clock, so we've got another couple of minutes. I believe we're still waiting for a couple of panelists. So yes, please feel free to use the chat to ask questions or introduce yourself, and we will start in just a couple of moments. Okay, so I think we'll make a start. Welcome everyone, and welcome those of you who are watching us on Facebook as well. Welcome to this first ever joint webinar with Lymphoma Action and Leukaemia Care. Just a few logistical things before we start for those of you who are listening. The webinar will be approximately 90 minutes, depending on the number of questions that we receive from you guys. Please do ask questions throughout the webinar, and we will be monitoring them and making sure we put your questions to various panelists. I think that's everything. If you are not aware of how to use the chat function, if you scroll to the bottom of the screen, in the middle, I believe, is the chat button. Just click on that and it should pop up on the right hand side. Hi Angie. I think there's a full house on the panelists now as well, which is wonderful news.
Hello.
Hi.
Hi.
So just to introduce myself, I'm Charlotte Martin. I'm the Patient Advocacy Manager here at Leukaemia Care. I've been hosting quite a few webinars for Leukaemia Care recently. I don't claim to be a pro at it, but yes, I'm well used to doing these now, I think. I just want to introduce my co-host to start with, Stephen. Stephen, do you just want to introduce yourself for me?
Hi, I'm Stephen Scowcroft. I'm the Director of Operations and External Affairs at Lymphoma Action. And yes, we're very pleased to be doing this in conjunction with Leukaemia Care. We've been doing a number of things in collaboration in order to support people affected by lymphoma and leukemia during COVID. And this is the first of a series of webinars that we're going to be doing over the next few months together. So we're looking forward to that.
So we've brought together this panel today to cover the topic of living with the psychological impact of leukemia and lymphoma in the COVID-19 era. So we, both Lymphoma Action and have been covering a lot of coronavirus COVID-19 related topics recently, and we're keen to get back to also delivering our usual services, things like webinars on topics that matter to patients. But we're also conscious that we can't escape the fact that COVID-19 exists at the moment. So we hope today will cover both the psychological impact generally of being diagnosed with a leukemia and or a lymphoma, but also give a bit of context as to how perhaps these things have changed in the last few months. Stephen, is there anything you wanted to add on that front?
No, I think we've got a mixture of panelists today from different aspects of both the clinical psychologists, some of the more practical side of things as well. But yeah, we'll let them introduce each other themselves at the right time, and then take it from there with some questions afterwards.
Agreed. Okay, so I'll introduce the panel then. Shall we start with Raj? Would you mind introducing yourself, Raj?
Sorry.
Would you mind introducing yourself?
Yes. I'm Raj Gupta. I'm a consultant psychologist and I work with cancer patients. I have been working for the last 12 years. I normally see patients at Good Hope. Is there anything else you want me to say?
No, I think that's great for an introduction. Thank you. And then Pauline, would you mind introducing yourself, please?
Hi, afternoon everyone. So I'm Pauline Aston. I'm a psychologist and I'm from University Hospital Bristol and Western now. So we've merged with Western in April. My job role is to work with a team of psychologists actually, and we input into oncology and hematology on sort of inpatient and outpatient basis.
Perfect, thank you very much. And Anne, would you mind introducing yourself for me?
Hello everybody, I'm Anne Crook. I'm a counsellor and psychotherapist. I work at the Christie Hospital in Manchester, supporting people affected by all cancers, mostly outpatient work. And before I came to the Christie, which was 10 years ago, I was 10 years as a counsellor for hemato-oncology at a hospital in London. So.
Angie, would you mind introducing yourself next?
Yeah. Can everyone see me okay?
Yeah, and we can hear you perfectly.
I'm Angela Watts. I'm a haematology research nurse. I work in the NHS and I also work as a nurse advisor to leukemia care. So I've been talking to patients on the phone during COVID, and I've also been seeing patients within the hospital where I work, in the clinic setting and obviously around the ward area as well.
Cool. Thank you, Angie. And last but not least by any means, Jill, would you mind letting everyone know who you are?
Yes, hi, my name is Jill and I'm one of the facilitators who works with Lymphoma Action to deliver a workshop, but I've actually been through the experience of lymphoma myself, and that's one of the criteria for being a facilitator. They're likely to have some lived experience.
So we thought we'd start the webinar today by asking each of our panelists to talk about the psychological impact of leukemia and lymphoma. So I'm going to ask Raj to speak first for approximately 5 minutes. Raj, did you want me to put up that slide now, or would you like to indicate it?
I'll ask you just in a couple of minutes. Yeah.
Wonderful.
Or you can put it up now so people can see what I'm going to talk about.
Yeah. There we are. Should be able to see it now.
Right. Okay. So what I'm going to talk about, I've called it the amygdala hijacks our rational thinking. I decided to talk about this topic for just about 5 minutes. It's an enormous topic, and my rationale is simply that the ideas behind this topic often crop up during my consultation with so many patients. What basically this means is the topic. If you look at this image, there is a part of the brain which is called amygdala. Now, and then you can also see part of the brain which is called prefrontal cortex, that is behind our forehead. Now, what happens is basically when, for whatever reason, we are emotionally aroused. Fear, worry, anxiety, any emotions, when they are highly would become emotionally aroused, then amygdala becomes literally overactive. If somebody did a brain scan at that time, they will see this part of the brain is really, really very active. And unfortunately, the thinking part of the brain, which is prefrontal cortex, that becomes less active. Now, what does this mean? That means when we are emotionally aroused, we cannot think. And normally, what most of us tend to do is that we want to solve life's complex problems when we are highly emotionally aroused. And then the reality is, if that is the case, we cannot literally think at that time. So what do? Now, when we are dealing with complex problems to do with treatment, to do with the family, to do with any fear or anxieties or worries we may have, we need to ask ourselves, am I relatively calm or am I not? If you are not calm, if you are agitated, and that also manifests physiologically, the way you might feel sweaty, your heart might beat faster, your breathing might get affected, so on and so forth, then that is not the right time to think about your complex problems. Then you need, until you calm down, one would not be able to solve any serious problems. The danger is, the risk is, what happens is, when under that frame of mind, we try to work out our problems, because we cannot think straight, we start believing, I cannot concentrate, I cannot think, I've got brain fog. We start conjuring up all sorts of additional problems and start believing them. And we incorporate, start saying, oh, now, because of the treatment, because of the diagnosis, I can't even think. I can't concentrate. I can't remember anything. Now, the reality is, in my experience, the last 10, 12 years, that is not the case. One is anxious, one is not able to think, one is not able to concentrate, is only for that short period when one is highly anxious, highly emotional. So really the take-home message is, please try not to think of complex problems when you are emotionally aroused, worried, unhappy, afraid, until you calm down. Okay? That's it. Is there anything else you want?
No, that's fine. Sorry, Raj. I was just struggling to unmute myself. You'd think I'd be used to this sort of thing by now. Thank you, Raj. I think that was a really nice way to set the scene in terms of what's actually going on in the brain of someone who is struggling with a diagnosis or at some point during their treatment with the emotional impact and what's going on in their brain. I think that's a really nice way to sort of set the scene for the discussions. Pauline, can I come to you to perhaps discuss a little bit about more recent times with COVID-19, how that's impacted on psychological services and perhaps the sort of issues or questions that patients have come to you with in recent months?
Yeah, so I suppose, thank you again for Leukaemia Care inviting University Hospital Bristol and Western along. I think I'm just going to sort of run through a few points that are preliminary findings, if you like, of an audit that the Trust has conducted, and hopefully that will answer some of the things you suggest. I will glance sideways because I'm sort of using notes as prompts, so bear with me. So really, I suppose initially when COVID-19 came in, one might say there was a very short kind of delay in terms of treatment being offered because of the planning that was going ahead for this anticipated peak of COVID-19. But having said that, then the peak didn't happen. Well, not in our sort of hospital, not in our trust. So we were able still from the medical side for people to be having their medical treatment when there was active disease. So that was still face-to-face appointments happening when there was active disease. So I think that's a really important point because I'm aware of people being concerned about treatment being stopped and treatment being delayed, but certainly apart from that very brief period at the beginning, the treatment continued on a face-to-face basis. And I think maybe what we've seen is actually how that experience has been for the patient. And again, we'll kind of see if Gillian can add to this later because I'm only speaking as an observer. I haven't lived this, but some of the feedback we've had is going through cancer treatment. Obviously, it can be very socially isolating. People struggle to connect and understand, you know, read textbooks, articles and everything, but it's the person that's actually living with it, the impact of not just the cancer, but the impact on all areas of their life. So that holistic view that gets affected. And some of the comments, although treatment has remained, medical treatment has remained face-to-face, some of the comments have been that meeting staff even more briefly and that the staff are wearing face masks and all the PPE, it's hard to get any sort of connection. It's hard to get that consistency of that relationship. And I suppose my view would be ultimately we need that patient's trust and to feel safe as they go through a really hard physical and emotional process. So the feedback from the patients has just been that sense of isolation and maybe adding to that sense of disconnection when you're kind of guessing what's behind the mask. And I guess it adds to quite that clinical picture of where you see the gloves and the aprons. The other thing we observed was that the signposting options shrank down. So the kind of next steps, health and well-being programs, we've all had to work really hard to think what other formats can we offer this in. So we've tried about sort of webinars and various platforms of technology, which have challenged the staff because, you know, but, you know, I think there's something quite human and quite nice when we say to patients we're struggling with the technology. It makes us a bit more human. But the thing to come out of the audit there is that actually the process is as important as the content. And even with our efforts to deliver the information through webinars, through sort of remote information giving activities, again, the feedback from the patients is that I need to connect with someone who's been through this, who's, you know, I need to know that what I'm going through is normal and experienced either by someone the same sex, someone the same age, or just somebody in that same context. So process seems to be as important as content. So we have worked hard at delivering psychology, both on a kind of face-to-face basis, also over telephone call, and also through virtual clinics. Mixed responses, if I'm honest. So some being sort of a city centre hospital and a regional unit, so people coming in from quite a distance, often the number one complaint has been, well, not complaint, but difficulty is parking and access. So offering those other avenues in has been really helpful, and we've had really good feedback. And actually our cancellation rate has gone from what it was approaching sort of 25%, it's now next to nothing in terms of cancellations. So cost effective, but it's not a one size fits all because not all presentations would fit remote access. I'm thinking perhaps more neurological type presentations. People that can't find that confidential space at home, people in maybe more conflictual relationships. There's something really helpful about coming in and sitting in the room with someone. So it is on a case by case kind of basis. But I think, yeah, generally it's just good to have those options and offer patient choice. So, and I think that is something that we'll, be taking forward and has been largely welcomed. And then we can have a much broader input across the trust from psychology. And I suppose that's it. Again, just adding to the DNA rates, it's the audit suggests there's lots of reasons why people don't come to appointments, but actually quite often, even if they can't physically get in, you can make contact with them. So I think in a nutshell, it's been a challenge for us not to compare it to that cancer journey, but certainly I think COVID across the board has kind of, set off reflections about how do we as people manage uncertainty, change, quick learning of new skills, adaptation, adjustment. And I know that's nothing like going through cancer, but these are themes we see as people adjust to their diagnosis of cancer. But yeah, I think now as a trust, our main concern is those that aren't attending to their GPs with perhaps what might seem like minor symptoms. And the worry is that we might suddenly get a peak of cancer patients where their investigations have been delayed. So that's our kind of main concern. But, we've kind of gone with it, taken up new learning, and hopefully that means now we have much more choices to offer patients. And so far, so good. So it's a forced, unwanted change, but actually some good, we believe, has come out of it. So
perfect.
I think that's
Pauline.
it. Okay.
A really great overview of the fact you're still open for business and you still want to see patients, and you've managed to adapt to the situation. That's really great to hear. And I'd echo your comments on concerns around people presenting to GPs. That's definitely an issue that I'm sure Stephen will agree that us charities are also concerned about.
Yes, I mean, it's a key message that we're both kind of pushing on, and on behalf of the NHS as well, in terms of helping us to help you to kind of get out there. And if anything doesn't feel right for you, then do contact your medical team or your GP or whatever stage you are at in your pathway.
Absolutely, yeah. If I come now to Anne, Anne, do you want to say a few words about the topic of today's webinar, and whether you have anything to add on either Raj's or Pauline's topics, as well as your own thoughts?
Okay, thank you. So I was thinking back to when we all began to feel the impact of COVID last March, and I think what struck me and struck some of the people affected by cancer that I was supporting was that some of the COVID experiences were already so familiar to those of you who've been living with the impact of a blood cancer diagnosis and perhaps going through treatment or being on active surveillance. Living with uncertainty and experiencing events as out of your control is all too familiar. When you're receiving intensive chemo or perhaps having a stem cell transplant, the experience of isolation and limiting who you see and where you go really is very much part of the territory. And also those feelings of vulnerability and having to take all those possible precautions to try and manage the risks of infection. So it, in some ways it's familiar. Obviously it's all so completely unfamiliar to all of us, this living in the midst of a pandemic. But I think that, that sense of out of the blue life suddenly changes in ways that you never thought you could have imagined. What was so normal, perhaps didn't give it much thought, suddenly felt out of reach. And life certainties have become much more unpredictable and uncertain. I remember the hematology professor that I used to work with would say to people when they were first diagnosed that the only certainty will sadly be more uncertainty. And you're all well used to that anxiety and the fear that uncertainty brings with it. So I think there's something about, hopefully in this webinar, reminding yourselves that you actually are the experts when it comes to living with events that are beyond your control, and that you've been pushed into a position of having to find a new normal already. You know, even that phrase, finding your new normal, started out in the cancer world before the days of COVID-19. I remember early on in the pandemic, one woman said to me, well, this is how she'd been living when she was going through her regular cycles of chemo. Just before each cycle, she'd go to the shops to stock up on food and essentials because she'd be too fatigued to go after her treatment. And she was reminded of this when everyone was clearing the shelves in the supermarkets of pasta and toilet rolls. And what she said to me was, she said, you know, it's like the whole country's about to start chemo. And I think she felt strangely comforted at that time that other people were getting a tiny glimpse of her experience, because she'd really felt quite isolated and alone when she was going through treatment, and other people didn't seem to get it. And I think since those early weeks, in some ways, this weirdness has become more familiar, and in other ways, it's got much, much harder. I think, you know, particularly all of the confusion about shielding and now not shielding has really turned up the volume on the anxiety that I imagine, you know, many of you are already feeling with the diagnosis. And I think you know, what I seem to spend a lot of time when I'm supporting people trying to emphasize that it's normal to feel so scared and worried. And it is hard to manage these very normal feelings in this really abnormal situation of illness. And I think that, you know, often when we're struggling psychologically or emotionally, we ask ourselves, well, is this just me? Or if I'm feeling like this, is there something wrong with me? And then we can put pressure on ourselves and tell ourselves that we should be able to cope. And I don't think should can be a very kind word to put on ourselves. I think it's also helpful when we realise that it's not just me, that it's normal to feel like this. And I think you know, the great thing about these webinars is that you can hear from each other through your questions that actually, yeah, I'm not the only person who feels like this. And when I'm supporting someone with counselling, I'm trying to give them a space, an opportunity to tell their story. You know, as Pauline was saying, we're having to really adapt and adjust and find new ways to enable that to happen at the moment. But one of the questions that I'll often ask is, well, what's helped you to cope with the challenges that you've already faced in your life? And life is about sometimes really difficult challenges, and that trying to kind of get back in touch with some of those strengths and strategies, and you apply those strategies to meet this current challenge. So, you know, there were some basic things that we know can help, things that I think it's really about trying to find in this situation where things feel very much out of control, trying to identify those things that you can feel some control over. So, you know, some short-term strategies that really help us to cope with stress. You know, things like giving a structure and a routine to your day, even though the routine to your day might have completely changed through all of this. Finding a mixture of activities that give you a feeling of accomplishment and hopefully some enjoyment. Getting out for some fresh air and enjoying nature. You know, somebody said, well, you know, I'm frightened to go out because of the risk of infection. So that person has started going out really quite early in the morning because she knows that there won't be so many people about, but it's made such a difference to actually get out of the house. And we know that any kind of physical activity is good and helps lift our spirits, and you know, it helps us manage the physical effects that Raj was talking about, you know, when we have too much adrenaline in the system because our alarm system is going off. You know, any kind of physical activity can help that. And I think the other thing that to really emphasize is the support of others. And I think if one thing COVID has emphasized to us all, it's how much we need and how much we value connecting with each other. As you know, as Pauline said, sitting in the same room with somebody. And you know, and I'm living in Greater Manchester, and we're on our own local lockdown at the moment, and it's so hard, isn't it, when you can't even sit in the garden with someone close to you. And so it's about how can we adapt and adjust, and who'd have thought 6 months ago that, you know, so many of you we'd all be connecting in this space virtually. So you know, we are incredibly resilient, we human beings. We can find ways around things. So I think, yeah, I'm sure we can, you know, talk a little bit more about that as the webinar goes on. But I think just, I suppose, to sum up, it's hard to make plans. It's hard to look ahead into the future. Again, a very familiar experience to you, living with a diagnosis. So I think it's about trying to become a bit more short term in our thinking. It's hard to make longer term plans, but even if we plan for the next few hours or what something we want to try and accomplish in the coming day, to bring ourselves very much back into the present, because anxiety is always focused on the threat that comes in the future. So if we can bring ourselves back into the now. So I'll end there and bring myself back into the now.
Thank you, Anne. That's really great. And I agree on the striking parallels between a diagnosis of cancer and COVID. It's something I've heard repeatedly from patients, and I'm sure Jill will speak to that afterwards. And thank you for some good tips on coping so far. I'm sure everyone will find those useful. And someone's already commented that they agree that, you know, it's just nice not to feel alone. So thank you for that. As a good start. Angie, can we come to you next? As a CNS, I guess you bridge an interesting position between medical professional and also emotionally supporting your patients. So how do you go about supporting patients who are just received a diagnosis or are currently going through treatment and things like that?
I think sort of going back to COVID, there's normally we help support patients through face-to-face. I think there's nothing like being in, as others have said, being in the same room. What I think is difficult as well, normally when you're supporting a patient that's having a new diagnosis or during that journey with them, then you've also got their family members with them. And so I think that the whole period of not having that communication, that relatives and family members have found it very difficult to not be able to say, come with the person to that clinic visit, and you know, that gap in communication. So what we've tried to do, I guess, virtually or through telephone consultations and face-to-face that we've had to, is that trying to bridge that gap, because we're trying to give them some structure, give them some trying to give them some answers almost. This is what we're expecting, this is what we're going to try and do, this is how we're going to, you know, complete your follow-up, this is how we're going to look after you during treatment. And I think, you know, relatives, the family members have found it really, really hard. And that feeling of isolation, when we've had quite a lot of phone calls, so there's been a lot of telephone consultations, and that's the sort of way we've been able to help support everyone, I guess. It's been quite difficult because you do, I think, rely heavily on that face-to-face communication, because it's what we've been used to over time. And I think learning to adapt. I think everyone, you know, the patients, their family members, trying to learn to adapt to this new situation so that they're not getting that first-hand information. And as we know, sometimes we don't take all that information in. It's information overload with some of those earlier visits, and not having that person there to sit with you and listen in, you know, and share some of that information. That's what some of the feedback from the patients has been. The other thing that's been really good as well is that I think that having a buddy, having another person with a similar condition to the patient has been very, very helpful. So again, other patients supporting each other via telephone discussions has been really, really good. And I've heard really good things about that. Patients have valued that, having someone at the end of the phone.
Thank you, Auntie. That was really useful. So, not last but not least, again, Jill. You've heard there quite a few professional opinions on how this whole recent period has been for patients. Would you mind sort of topping that off with how living with lymphoma has affected you, but also how that's changed since COVID's come along?
Yes. Hello, everybody. I'm Jill. I was diagnosed with follicular lymphoma in 2016, September 2016. At that time, I was working as a teacher, and I was in work one day and then not the next. I'd had no symptoms, so the diagnosis came as a total shock. I ended up in hospital to start off my treatment. I had chemotherapy and radiotherapy, then the maintenance treatment, rituximab. And basically everything had sort of gone through by about, or finished by about July 2017. I actually spent 3 months in hospital because of recurrent infections. With hindsight, I don't know whether that was a good thing or not, but there was no internet connection, and it meant I couldn't research the condition. And I think if I have one thing to say to people who've just been recently diagnosed, is to be very careful about where you get your information from. And certainly, I mean, we're particularly looking at lymphoma and leukemia here, go to those relevant charities. It's very easy to absolutely terrify yourself if you rely on google.md, as I call it. To get back to my diagnosis, it was a total shock. And as I say, I'd had no symptoms. I was then rushed straight into chemotherapy. And at the time, as I say, I was a school teacher. I just remember a total lack of control. And that really impacted on me, because being a teacher, you're used to being in control of your class and dealing with situations. You have to sort of take a step back and put yourself in the hands of the professionals, which is what I did. I thought my treatment was very good. As I say, I did have infections, and therefore the treatment had to stop. But any questions that I asked, the consultant was very good, the medics were very good. What I did find when I was actually having treatment was that I kept a diary of, because I was sort of 3 weeks in between the different chemotherapies, a diary of my symptoms, or how I felt, my mood, and any physical conditions I had. And that meant when I went into the next round, I could look back on that. And for example, day 8 might have said pains in the back, and I had pains in the back, and I thought, oh, well, that will pass. I think Anne hit the nail on the head about the uncertainty, because that is really difficult to deal with, and to try and take control of what you can. Once you get through your treatment, and as I say, I have follicular lymphoma, so the chances are, I've been told, it may well come back. And that itself has an impact, because you keep thinking, at first I thought of it as like a sword of Damocles, but as time went on, that became less of a problem. So that really leads me now into the COVID era, because I would say I'd got my life back together, and I was starting to enjoy and do things all that I wanted to do. I didn't really think about my condition. And then suddenly I got the shielding letter. And so I was right back to where I started. The condition, which I hadn't really thought about, became very important again. I live on my own, so I had to do a lot of organising. I don't think shielding itself I found particularly difficult, because I did have a lot of support from family and friends who were doing the shopping for me, ringing up. I can keep myself amused. As I say, I live on my own. I'm a widow, so I live on my own. So I was used to amusing myself. And in fact, I think a lot of my friends were contacting me and asking how to get through the day. I think it was Anne who was saying that a lot of people felt that this was the first time they could actually empathise with people who'd had cancer. The other thing that I found difficult, I did have the reassurance of going along for my 6 monthly checks with the consultant. Well, of course, with COVID, it became a telephone appointment and I didn't have the blood tests. And I'm not particularly worried, because with lymphoma, and as I mentioned, I am a facilitator for the Live Your Life, I was given the tools and the information to self-manage or to recognise when something may become an issue. But it is still difficult to feel that you didn't actually have that reassurance. And now that everybody else is out and about and doing things, and I can get out there for a walk, I'm feeling quite concerned by the lack of social distancing. I don't think people appreciate that people who have been shielding may feel very nervous about going out into the wide world again. My friends are picking up their life, and I feel I don't want to go to, you know, they're going to the pub for a drink or something. I don't want to do that. I've not been to a shop yet, but I'm determined to get on with life in the best way that I can. And basically I do it by a form of risk assessment, I suppose, for want of a better word. There are places I will go. For example, I'll go for a walk to the park. I will go down to the coast where I live, but not on sunny days where I know it's going to be heaving. I actually went there this morning and it was raining and there was hardly anybody there. I have actually been out for a meal. I went yesterday, but I knew it was going to be a very quiet place. And I think it's a case, from my point of view, of building up confidence again to get out there. I'd had the confidence, and COVID pulled the rug out from under my feet, and I'm having to start to find yet another new normal. I mean, we've already, one of the participants has mentioned a new normal. Well, I feel I'm on about version 5 or 6 or something now. I'm determined not to let COVID stop my life. I don't just want to survive or just cope with things. I actually do want to live well. I would really prefer to be more informed about the risks, particularly to lymphoma people and I should imagine leukemia people, so that I have a better basis on which to assess how I'm going to carry on the rest of my life. But apart from that, I've empathized with everything that the other participants have said. I don't know if I was on the screen. I'm on my phone, so I can't see very much, but I'm nodding away at Anne's comments about uncertainty. That was very difficult to deal with. I think for those of you who are newly diagnosed, the lack of control is difficult. For people who are having to undergo treatment now, whilst the COVID crisis was on, I think you've got extra stresses and strains, but I'm sure the medical professionals really seem to be on top of things and are providing as much reassurance as they can. And I think really that's all I've got to say.
Thank you, Jill. That was really inspiring, and lots of tips in there for other people, which is really, really helpful. Thank you for that. Stephen, I think it's time we go into the questions. Would you like to pose the first one to our panel?
Yeah, I mean, I was just going to say, so thanks very much to everyone who's been posting questions in the chat or on Facebook and kind of putting them through to us as well. We won't be able to necessarily answer all of those individually. Some of them are quite technical and unique, and the focus of today is really about coping and the psychological impact of leukemia and lymphoma. However, both leukemia and lymphoma have got other means for having conversations with a wider community, or particularly with helplines as well. So, and as a follow-up, we may see what we can do to answer some of those more specifically as well. Absolutely. So I just wanted to say that. Thanks again for everybody. And I think one of the themes that's really come out is about you know, that's different ways and different approaches of doing it. And I guess one of the biggest challenges that people have kind of put through to us as questions is how do we mention a couple of different kind of ways of doing it, but particularly I think start with what Anne had highlighted, is that actually people have dealt with challenges before. That's what life is about. But how can, perhaps in a more practical way, how can they kind of reach into that, whether it's through support networks or through their own coping mechanisms, particularly when it comes back to cancer, and whether that's a diagnosis or going into a new form of treatment. You know, it's quite easy, as Jill said, to kind of forget about some of those things that you have dealt with before. But have you got any ways that you can share with people just to kind of tip back into that coping mechanism that everybody does have? Perhaps Raj could start with that, just from going back to your fight and flight, setting scene context, and then others can take it from there.
Yes, Stephen, you made a point, to my mind, that's a very, very important point. And that is, people forget that they have coped with challenges in their lives. All lives, people have coped challenges. Now, what happens is, because, as I said in my introduction, they look at the problems when they're emotionally aroused. They start believing, oh, I can't deal with it. But they forget at that time, they have dealt with all the problems. So this, in addition to the diagnosis of cancer or leukemia, in addition to that, they start believing they have lost their ability to cope with challenges. No, they haven't. I don't think people have lost it. Yes, they're overwhelmed. It's very, very difficult to deal with the situation. And I think secondly, we need to bear in mind is that sometimes we expect to come up with the life's complex challenge straight away. We can't. If we look at, for example, how with this COVID-19 all over the world, with this small problem, so many scientists are working hard. Life's problems are no less complex than finding solutions to scientific problems which scientists are trying to find. So if they can't find an answer straight away, it doesn't mean they need to infer we lost the ability. No, I think either the problem is difficult, and secondly, leave it for the time being. Our unconscious mind also works on the problems. So sometimes when they are relaxed, their unconscious mind can come up with the answer. They should not, to my mind, start believing that they can't cope.
Thanks. I guess, Pauline, to kind of to add to that, I think one thing that came out is it's okay not to be okay, and kind of building on what Raj had said. Have you got any kind of more to add to that?
I guess I'm thinking more practically, really, maybe some skills to take away for people. I'm conscious you can only see my face, so I'll put my hands up where you can see. But just as a little exercise, if people wanted to put their hands together with their middle fingers touching, then to place that on your tummy. And when you breathe in, work towards when you breathe in, your tummy goes out, so that it should create a bit of a gap and push those middle fingers apart. And it will take time. It's a new skill to develop, but when you are stressed and anxious, you use all the muscles at the top, which is great for a short burst of energy and a short burst of adrenaline. But when that adrenaline is in your system for a long time, you can get concentration problems, stomach problems. So just as a general way of keeping those anxiety levels down, practice 3 minutes of breathing when you breathe in, tummy going out, and getting that feedback through those hands on your tummy, 3 minutes of that has a real chemical effect on the brain and will bring those stress levels down. And there's lots of relaxation things out there that you can listen to, but the working component is that diaphragmatic breath. And I tend to also pair that with the thoughts that come in. And we know that with thoughts and feelings, the opposite is true. So say, as a random example, if you had a dirty carpet, you'd get a hoover and you'd clean it. It's a straightforward relationship. But with thoughts and feelings, the minute you say, don't feel like that, don't think like that, then the opposite happens. So that's an inverse relationship. So one of the things to do is to start practicing catching those thoughts, saying, I notice I'm having the thought that, I notice I'm having a feeling of, and your mind might undermine you saying, I haven't got time to relax. So I notice I'm having the thought that I haven't got time to relax. I then, as an example, one technique is to imagine yourself standing on a train platform. I notice I'm having the thought that, you put it on the train, you watch the train come in and you watch the train leave. And the thought might show up again, you put it back on the train, watch it come in and watch it go. So we're not pushing thoughts away, we're acknowledging they're there, but we're kind of making the decision not to listen to them and to let go of them. So that, paired with the diaphragmatic breath, can help move you towards that settling where you're probably in a better place to practically think through what's within my control and to name what isn't within your control.
Thanks. And just, right, it kind of naturally leads on to kind of Anne, actually. So you gave some examples of where obviously talking about and verbalizing, giving space to tell a story is really part of that. And sometimes actually during lockdown, that's not quite as easy as it has been previously. And other people have mentioned about some of the techniques they use, mindfulness. There's lots of places, lots of different things that might suit different people, lots of places that they can go for help. So again, is there, building on that, what other examples are there for people to explore, to find out what works for them?
Yeah, I mean, I think what you're saying, Stephen, is key. That different things suit different people, and it is, you know, sometimes it's trial and error. And you know, I've kind of got through lockdown and the challenges of working from home and working in these very different ways with excessive online yoga, but it's, you know, that's not for everyone. I think in terms of finding that space to talk about it. I mean, for some people, you know, some of us aren't talkers. Some of us, you know, prefer to do our own find our own way of reflecting, and you know, and that might be sort of keeping a diary, or it might be something, you know, completely unconnected, and making space for activities that actually this is kind of like non-cancer time. This is non-lymphoma, non-leukemia time. This is my time to do whatever. It's, as Pauline was saying earlier, it's much harder if you want to find some professional support, but it's out there. There's lots of online virtual support, cancer support centres of varying kinds, the great you know, sort of charities and patient support organisations like yourselves. So your helplines are still going. Now webinars, perhaps rather than, you know, physical meetings. I think the power of recognizing that you're not the only person going through this experience is so helpful. You know, I've run groups and attended groups, but it's always the conversation over the coffee that is the one that, you know, people take away, and it's kind of, oh yeah, you know, and it might not be exactly the same diagnosis or the same treatment, or, you know, it's always very individual, that sort of pathway through treatment, but it's just that, oh yeah, that person gets it. So I think it's about yeah, I mean, it's easier to find out what's out there just by ringing your helpline, looking at all the material that's there. Some people say, well, actually, I don't want to come and talk to some stranger. You know, I've got good support from my family and friends, but often it's the case, you know, people describe the people that they thought would be supportive and there for them either disappear, or they manage to say the most ridiculous, unhelpful things in response. Whereas perhaps someone they hardly knew, you know, just actually hit the spot and really became, so it's again, it's kind of like seeking out the relationships that are really supportive and helpful, and, you know, finding family and friends who are good listeners, who don't want to jump in with advice or downplay how you're feeling, or, you know, or be strong, or you can fight this, and all of those things that we know can be a sort of, you know, a common response, because it's actually harder to just sort of sit there when you're saying and wanting to try and describe, actually, I'm feeling really rubbish about this, I'm feeling really angry about it, I'm feeling really frightened, you know, I'm struggling, I'm having an off day, just to be able to make that connection. So you know, it's hard work, this being ill, having a diagnosis. It really is hard work and challenging, kind of emotionally, physically, and then having to find your way through it that works for you. But yeah, I think you know, it's great how you've been describing your experience, Jill, because you've kind of like come through all of those and then been thrown back into it, but it's all possible. Yeah.
Yeah, I was going to then kind of add that, so from Jill, from your point of view, you've probably tried lots of different things. How did you kind of work your way through those and find out what works for you? Because yes, you gave a very good, inspiring experience when you had your cancer and your diagnosis, and then how you adapted that to COVID as well. So how, perhaps, have you got some tips for other people about how they go through all those, everything that's out there to find what works for them?
Well, I think from my point of view, family and friends were really important. And I was nodding there when Anne was talking, because although I've got through my treatment, you know, over 2 years ago, I've had quite a few friends diagnosed with cancer just recently, not lymphoma or leukemia, just other types. And one of them was saying, oh, one of my friends, she rings up every day. She said, I'm sick of that. And I said, well, would you rather she didn't ring up? Some people, if they've had no experience of cancer in their family, they're concerned, but they just don't know what to say. And I said, I would rather they said the wrong thing than said nothing at all. And I did say to another friend, people are going to be concerned, but they're going to say the most silly things to you because they don't quite understand. And you just have to go with it. But from my own point of view, coping with it, as I say, I'm quite used to being on my own, and I was very lucky in that I could retire, because I was very much defined by my job. So to leave work was very disappointing. I volunteered to become school governor because I still wanted to be involved in education. Just to bring this back to the COVID crisis, I've been attending regular governors' meetings, and the most recent ones have been virtual. But of course, now the schools are going back. I'm thinking, well, does that mean the governors' meetings are going to be in school? And this brings me back again to what I said in my talk. I'm a little bit apprehensive about going anywhere where there's any number of people. Just mindfulness, I don't think I particularly knew I was practicing mindfulness, but I've took a great deal of comfort of sitting in the garden and just listening to the birds and watching the flowers grow. I couldn't focus, certainly when I was undergoing my treatment, I couldn't focus on the television, I couldn't follow a series, I couldn't really read a book. I used to flick through magazines, but I just tried to keep myself busy. And friends would ring up and say, can we visit? Obviously, I didn't have a lot of people visit at one time, but I used to say, can can we just, you know, one or two of you come, and if you've, I was actually quite, not blunt, but I used to say, but please, if you have a cold or anything like that, please just ring up and say that you don't want to come, because it's very difficult for people who've not been through it to appreciate the risk of infection, and what might be a minor sniffle to them could actually have serious impact. Coping during COVID, and I mean, I'm very aware that possibly we may go back down into lockdown, or there may even be local lockdowns. I wasn't really prepared, but now I've stocked my cupboards up. I've got books in reserve. And I think if we do have to go down, then down the lockdown route or a local lockdown route, then I think it won't be quite so bad, because you've been through it before and you know what to expect. I think the first time was just what's going to happen. And as I said, the shielding letter, those of you who received shielding letters, I found them quite intimidating. And then at the other end of the equation, the 31st of July, you can't go, 1st of August, you can go back to work. And it was sort of like, again, you seem to have all these protective mechanisms, and then you're just out there in the wide world without really, I felt, a lot of support or information. So I don't know if that answers your question.
Yeah, thanks. And just to kind of tie that round back to Angie as well, in terms of from a CNS point of view, I guess obviously a lot of the things we've been talking about, you know, are accessible online, etc. But there are also a lot of help and support that people affected in different ways, whether it's from and someone's just mentioned some of these actually apply for people with depression, or you know, you don't have to be seriously mentally affected by something before you can access help that is available. So have you got any particular tips for what people could ask for from their MDT or their consultant or their CNS from your experience as well?
Yeah, I think it's important for us as healthcare professionals to actually listen to those cues that patients, you know, what are they trying to explain to us? Because if you know, some patients as well, they find it difficult to perhaps explain how they feel, and it's important that they try and get the message across to us, because like you say, there are you know, there's places where we can give them advice, we can put, you know, signpost patients in the right direction, that there's centres out there that even if like currently they can't go, there might be something where we could post some information out to them. So there's lots of different ways, but I think it's important for us to listen to what our patients are trying to tell us. But please don't be frightened about having a discussion with your clinician and your specialist nurse, because we are there to help, and we do need you to explain, especially now where the face-to-face appointments are limited, because you know, body language and again we're in sort of PPE, so our expressions and you know, it's a little bit more difficult to try and how someone feels, but it's so important to try and get that message across to us, because we are there to listen to you and we are there to try and help if that's something practical. But I think we need to be clear and give patients and their family clear instructions on what, say, that we're trying to keep them safe, that if it's a face-to-face appointment, this is what you need to do in practical terms, this is how we're going to get your medication to you. So I think sometimes, you know, it's important that we give clear messages, but please, you know, we want patients to feel that they can talk to us and they need to tell us how we feel, so that we can give them the right advice, but you know, how we can help them as individuals.
Thanks. Charlotte, are there any other questions that we haven't that are coming back and through?
I'd say most of the questions coming in are about specific scenarios, which we can definitely come on to in a moment. But I wanted to ask something before we went on to the specific scenarios, kind of following on from what you've just said, Angie. How do people recognise what level of support they need? I mean, there's a lot of discussion at the moment in the media and things about the mental health impact of COVID. How do people recognise, what advice do you give to people in terms of knowing what type of support is most appropriate for them? Just starting with Angie, but I will come to other people as well.
I think when we do assessments with patients at the beginning, and obviously we offer those support structures. So I guess initially it's trying to be able to have that conversation with the patient and the family, and being honest about how you're feeling. Are you struggling, emotionally, or is it something socially with work? There are lots of things that patients and families worry about. There's the social side, there's the financial side. So there's lots of different reasons, and sometimes patients may find it difficult to actually voice their concerns. So I think it's, I would say that before it was maybe a little bit easier to pick those signs up, but with the virtual telephone consultations, I think people may struggle more. And I think as that, about listening, but first of all, I think it's patients and families trying to tell us what they think they need, or and then we can sort of pinpoint them in the right direction. But yes, obviously we've got our healthcare colleagues to be able to refer to. We've obviously got support from the charities where we can try and get someone, say some counselling, or if that might be a financial, they might struggle and have an impact on their emotional well-being because they find it difficult to be able to get into an appointment because they may have transport difficulties, or how are they going to pick up their medication. So it's lots and lots of different things, and I think it's unpicking some of those issues with the patients. What is it that they need, what are they struggling with, and then we can maybe take steps then to point them in the right direction. Absolutely. There are lots of things out there that's available, like you say, online, and more so at the moment with COVID.
Yes, I feel like spending all my time on the internet lately.
Yeah.
So Pauline, I wondered if you could pick up on that and say a bit maybe about if a patient is wondering whether they need the support of services such as yours in terms of maybe perhaps more professional support. How do people identify when they perhaps reach that point, or is there a point at which people reach that they should know about? Maybe there isn't.
I think it is to acknowledge, first of all, that we're all human and to experience a range of emotions, and a range of emotions will show up. I guess it's also sometimes identifying what's left unsaid. And sometimes in terms of communication, if you broach a subject and someone shuts down, or they walk away, or they don't want to discuss it, just as a kind of an aside, I would kind of share that observation and say, I notice every time I mention this, you walk away. What can I do to help you feel comfortable to look at this? And think about letter writing, emails, text messages, and just find a means of communicating that need. I think it's I judge it by, is this impacting on a day-to-day basis? Is your level of anxiety perhaps at such a place that you're not engaging in life anymore? Is your fear of what might happen stopping you engaging with today? And I guess it's just with depression and mood changes. So usually people, when they have a low mood, they have an insight that appetite drops off, sleep gets disrupted, and there's signs like that. But I guess we also rely on relatives to say, this is out of character, this isn't, they're saying it's all right, but actually this is what we're observing. But I do want to emphasize that feeling sad, feeling angry, having sort of transient bursts of upset, this is scary stuff at times. You're going to feel it, and that's human. But when it starts disrupting your life, and you're not engaging in life, then I think that's perhaps when to inquire further. And it's not a weakness either to, even if talking therapies isn't for you, it's not a weakness to just run the idea past those involved in your care to say, what would it be like to have some help in terms of antidepressants? Obviously, as a psychologist, I'm biased and I would say skills before pills, but by no means should there be a judgment or a sense of weakness by having that conversation, because when you have a cancer diagnosis and you go through something like this, it's an extraordinarily high level of stress, and just to acknowledge that.
Thank you for that.
I wonder if I could come in there.
Of course, Jo.
From the patient perspective, I mean, I can remember I did actually seek counselling. I think I take my hat off to the royal family, who've really sort of made it less of a problem to admit you do have some difficulties mentally. It's a lot to come to terms with when you have a cancer diagnosis, particularly if you think it may be terminal, or am I going to get better? And I mentioned I'd got through all my treatment by about the July 17, and I'd had radiotherapy, which actually made me absolutely ill. I was very, very poorly from it. I think I was vomiting 24/7. It was dreadful. And I started to recover from that. But I can remember, I'm usually a pretty upbeat type of person, but I remember after a few, well, I don't know, maybe it was a week, 2 weeks, something like that, I thought, I don't think I'm going to get out of this by myself. I need to talk to somebody. And by this time I felt, as I say, I have tremendously supported family and friends, but I felt as if I didn't want to put the burden on them anymore. And we have a wonderful little local cancer centre around here. And I went in there, just called in, and I left with an appointment to see, it was a professor of oncology. He was talking to me about my condition, some wonderful alternative therapies, not alternative, complementary therapies, and also an appointment to see a counsellor. And I actually had several appointments with her, and I will say she helped immensely, because I could tell her things, because your family and friends are worried about you, and sometimes you don't actually want to tell them exactly how you feel, because they feel bad for you, and you don't want to upset anybody else. So to actually go along and talk to an independent third person, I found really helpful. And it's all confidential, and I'm not afraid to admit I did seek help. But I do think it's a question of recognizing that you might need that help. And as I say, it was a matter of a few months. I think I went once a week and talked to this lady, and then that was it. But I think you have to recognize yourself that you might need to seek outside help.
Absolutely.
And just to add on to that, sometimes it might be that not only, so we're talking about people affected by leukemia and lymphoma, and there's not only the patient themselves recognizing this in themselves, but actually their friends and family and carers, not only kind of recognizing that in the person who's got the diagnosis, but also in their selves as well, because they need to, a lot of treatment, and it's obviously about the patient, but also it's important for people who are helping to support that patient to seek the help that they need at times as well, and not to just kind of carry that burden alone. And again, that's something that both Leukemia Care and Lymphoma Action have information and kind of signs, etc., to help support those people who are supporting people affected by a particular diagnosis.
Absolutely. All of our services, and I'm sure it's the same for Lymphoma Action, are open to anyone affected by leukemia, and that includes absolutely anyone, friends, family, employers. We will happily support anybody. Stephen, I wonder whether we could we'll come to Anne and Raj first for the next question, but I'm just conscious of time is slipping away from us. Maybe we could ask a question maybe related to a specific topic or scenario, because I know we've got quite a few of those on our list.
Yeah, so I was trying to kind of pull together. So we've had things about people kind of returning to school. What can they do particularly about that, and about should they be wearing masks, should they not be wearing masks, or people and kind of holding out hope for a vaccine. And again, that causes isolation. I guess we can't necessarily answer those specifically, but actually I think what it highlights is that there are still quite a lot of unanswered questions. And again, so how do people kind of cope with those unanswered questions? Maybe one of the messages that then to kind of speak to your consultant team, speak to your CNS about trying to get some of the answers to those questions. Obviously, leukemia and lymphoma organizations are trying to also represent people affected by the diseases to try to kind of get some of those answers, but sometimes they just answer those answers right now. And so how do people kind of manage not being able to answer those questions specifically while still trying to kind of live their life? Yeah, I think that's the kind of way that we can summarize that question and kind of put it back out to, say, Anne first, to kind of try answer those
that,
questions.
Stephen. It's so, I think it's so hard that we're in this completely unprecedented time, and like nobody has the knowledge or the information. It's changing all the time, isn't it? And we're, you know, it highlights how much we've relied on science and research, and here it is that we're kind of, you know, really at the kind of like the frontier of trying to find out about you know, to be able to answer some of those specific questions, and nobody seems to really know, and the messages, you know, you know, this is a public forum, so I can't be too forthright about, you know, our leaders, but and don't worry, I'm not going to be, but you know, we have to, I suppose, let's be kind and feel for those in positions of authority who are really also struggling and trying to, you know, keep one step ahead, if you like. So then it comes back to our individual approaches. You know, I liked what you were saying earlier, Jill, about risk assessment. And you know, if anybody's ever been to a financial advisor and they want to know what's your attitude to risk, and really, you know, I just want somebody to tell me what's the best thing to do with my money so that I'm, you know, going to be able to afford to retire at some point. But they don't do that. They want to know what's your attitude to risk. And I think it's something about, well, you know, what's my attitude to risk? I think for most of us, especially in the cancer world, our attitude to risk at this time will be, well, actually, you know, we want to do low risk activities. So if it's about, you know, perhaps going back into school, if you're a teacher or a governor, or you're worried about your kids going back to school, it's trying to mitigate the risk best you can. I mean, I know in my workplace, you know, people are having risk assessments. Every staff member is to have a risk assessment so that the employer can try and make adjustments as necessary. I know some employers are, as is always the way, better than others at accommodating staff. But I think it is about trying to work out, actually, with the best knowledge that I personally have, this is as far as I'm prepared to go. So, you know, whether that is, you know, actually, I've passed pubs with people sitting outside and I thought, no, I'm not going to go and do that. Whereas I, like you, Jill, went out for a meal for the first time yesterday evening because I knew that it was very well managed and I felt safe. And so it is about that sort of assessing risk and what we're prepared to do. And I think the other thing to say is that struggling though we all are, there is just this sense of having to accept and get on with that there aren't the answers. People don't have the answers, and it's really, really frustrating. But that's the nature of this weird time that we're in at the moment. So, you know, again, it's bringing it down to, well, what can I manage? What works best it can for me?
And just kind of picking up on that, I think the message that we would reflect back around that is that have those conversations with your work or your workplace or with the school if it's about your child going back to school, and kind of talk through, you know, what your concerns are, and then what they can do to help to mitigate that. Because, you know, I think generally people are understanding and want to do what's best, but kind of perhaps struggling for them to find the answers as well. So I think that's the main message, to kind of have those conversations. Yeah, you want to come back?
I think there's something about, you know, because we're all feeling our way, you know, as we're trying to redesign our services, etc. So it's not until the question's asked that then we think, oh, well, we hadn't really thought about that. We haven't thought that through. So we really are having to kind of work with each other. So
Yeah.
I absolutely keep asking the questions.
Okay, I think Pauline, got anything to add to that? Anything on that?
Well, I was actually distracted by some of the chats that came in, and it was just saying, I just wanted to add to one of those comments, if it's all right. They were saying that in the press, it was saying that people with blood cancer are higher risk. I think it has been publicised that older adults and people with blood cancers are maybe at higher risk of contracting COVID. And I suppose that again sort of is an argument for putting on sort of remote clinics for people. And of course, with medical and treatment decisions, it's constantly weighing up whether the risk is worth it. So when you're looking at there's absolute active disease, then the risk of coming into hospital to have the treatment for it is worth it. But where perhaps for a psychology appointment where we're not doing a medical intervention and the risks are high, you may choose, knowing that you're more of a risky population, to opt for a remote appointment. And I think Jill's comments are very sensible. And I would just kind of say, do whatever keeps yourself safe. And worst scenario, if someone did contract COVID, please guard against judging yourself or blaming yourself for contracting it, because we don't have the full knowledge on this, and everyone will be individually risk assessing, and it's just being true to yourself and doing what you can to make yourself feel safe. And it might actually take you a bit out of your comfort zone to find that assertive voice within you to say, actually, I'm not comfortable with that, and to negotiate what would make something feel safer for you. But of course, there's no point putting your life on hold and keeping yourself so safe you're not engaging in life. It's hitting that quality of life as well as managing risk. So I think those are the things I would add.
For that research, there will continue to be more research, and the more that goes on, the more knowledge that people have and can then apply that to that kind of different risk stratification. But the flip side of that is we're never going to be 100% safe in anything we do either. And before COVID, a number of people with a blood cancer diagnosis already had to be conscious and cautious of general infections. And one way of looking at COVID is that it's just another infection adding to that kind of same approach as well, depending on whether it's an acute diagnosis or a chronic diagnosis around it, and kind of living with those and trying to kind of adapt in that way as well. So hopefully that's something to kind of keep in mind as you're kind of making these individual assessments as well as to what's right for you.
Raj, I wondered whether you wanted to add anything on the rationalisation of risk, but before we go on to another question, was that you talked a lot at the beginning about how we process these sorts of things in our brain. I wondered if you wanted to add anything there.
This again, it be repetition of what I've said. You use the word rationalization of the risk. Now, if we are, I'm repeating myself, emotionally aroused, our rationalization is not going to be, we are going to see a lot more risks, a lot more dangers, and then see that's going to add your own ongoing anxiety and worry, and you see the whole thing in a more anxious way. So, to repeat what I said earlier on, in order to evaluate events in life, it is very important that we stay as calm as possible. And for example, that Pauline made this suggestion about you can call it by either mindfulness, or there's another word which has been used, is called evoking relaxation response. Now, it's absolutely superb what she has said. I think what at the same time, what in my experience, what I find is, and what evidence shows is that 85% of the clinical outcome when we see patients is is as a result of what kind of relationship we build with the patient. That relationship is of extreme importance. What therapeutic input we use, that contributes only to 15%. Now, in this kind of webinar, the sad point is that we do not have that opportunity of building a close, trustworthy relationship for them to accept, say for example, Pauline's suggestion of 3 minutes paying attention to your breathing, and really what it's doing is, from physiological point of view, it is slowing down your sympathetic nervous system and activating more parasympathetic nervous system, which means you can think more calmly. But what say I think one of the things which I do believe, there is a thing called face validity. Now, face validity is if what we say doesn't make any sense, doesn't sound convincing, no matter how sound the advice is, the chances are patients aren't going to implement. I also work with HIV patients, and compliance is quite a big problem. So the therapeutic reliance is very, very important. And all the suggestions which have been made really are, I couldn't agree more with them. Okay.
Thanks, Raj. Stephen, I think we've got time maybe for one quick fire question if you had an idea.
I guess it'd be interesting just to kind of get a couple of views on where they think the future holds for this as well. Obviously, there are things that have been put into practice, and we heard about those under kind of COVID, particularly around dealing with heightened anxiety and the kind of knock-on effect of isolation on people's mental health. So perhaps very quickly, one thing from everybody is what they hope would still be implemented into the system that has been kind of piloted or had to be put in place during COVID. So perhaps Pauline, go first on that, as you kind of gave a good summary of what your hospital has been doing.
Yeah, so I'll just, sorry, I won't take too long, but Raj's comment does fit with our audit that process is as important as content. And I think in terms of the future of the hospital, it's nice to have explored different platforms so that we can offer more patient choice, which gives more power to the patient in terms of managing their own perceived risk when the evidence is still to be kind of built and developed. Okay.
Thank you. Anne?
I'd echo that. I mean, I think what we've discovered is that actually virtual therapy through video or telephone works very well for some people for various reasons, and so we'd want to continue to be able to offer those in a way that we hadn't done previously. Hopefully we can build back up to more face-to-face work as well, because for various reasons that's also needed, but I think we've had to adjust. If somebody had told me 6 months ago that I'd be doing most of my therapy sessions virtually, I just said, well, no thank you. I'm not sure that that's where my skills are. I certainly don't have the training, and actually more broadly, we are incredibly adaptable, and we can adapt to all sorts of things, we human beings, and I proved myself wrong because some of it is working very well. So yeah.
Well, thanks. And Raj?
I didn't quite understand the question actually, Stephen.
I was just saying, is there anything that we've had to put in a lot of new things during the COVID crisis? What would you like to see continue as a result of that might be different to what we had pre-COVID?
See, and what colleagues have said, I go along with that. Hopefully, by working, if this is going to be an important way of working, improving our skills offering intervention remotely, this would really, I mean, how to continue to improve so our intervention is effective and acceptable to our patients. And I think, yeah, as probably one of the colleagues said, that some patients, they do accept that the intervention over the phone remotely, and it does work as effectively as face-to-face. I agree. I think we need to keep on really evolving what we are doing and making our intervention better and more effective.
Thanks. And Angie, from your experience?
Be new ways of working, and I think maybe we were a little bit, let's say, struggled with that concept at the beginning, but I think as time's gone on, we've started to get used to the combination of having that face-to-face, but also telephone follow-up with the virtual clinics. So I think going forward, there may be where patients might be seen on one appointment, but it would depend on how far into treatment you are. So for instance, I guess you may have a little bit more contact face to face if you're currently in active treatment, that may be, with your CNS, in day case setting, or your clinician as well. And then maybe as you finish your treatment into that follow-up phase, that there may be then more scope for this virtual assessment and follow-up. But I would say that for patients and the families, please engage with your teams. Don't be afraid to pick up that phone and maintain contact with your specialist teams, because that is key really for both sides to keep that communication open.
And Jill?
Well, I've not really had much experience of Zoom meetings. I mean, it's been a very steep learning curve, and I'm on it now. As I explained in my little chat, I've had communication with my team via a telephone call. I think next time I'll ask for a video call, because I actually like to see who I'm speaking to. But just in a general context, if we're talking about what we would like to see going forward, having been shielded, and I think a number of people have been shielding, I would actually like to see something like a designated hour in a supermarket, so that shielding people could go and feel safe. Because I haven't been yet to the shops, but people who've gone have told me that nobody's maintaining a social distance anymore. So I think we're pretty late in the game getting out there, and I don't think I feel unsafe. I just avoid those situations. If it came to it that the infection rate was rising again, and research seems to show at the minute that the younger people aren't actually as badly affected as everybody else. I said a couple of months back, I would maintain shielding, I would stay shielded, because I want to protect myself. But just because I want to protect myself, I don't actually want the whole world to stop and for the economy to grind to a halt. We have to take a balanced view, and I would be prepared to sort of stand back and accept some form of shielding again, if they would make some provision for us, because really there wasn't a lot. And now that we're out in the wide world, I'm just avoiding difficult situations.
Okay, thanks.
Wonderful. Thank you for those last parting thoughts, panel. Before we say thank you and goodbye, me and Stephen just have a couple of things to share from, about our services from the two of us. So in terms of information services, I mainly wanted to highlight these webinars. I think they've been a really wonderful way for us to keep in touch with patients throughout the COVID-19 pandemic, and we plan to continue them. And we are planning another one with our colleagues at Lymphoma Action soon, but we do provide information in a number of different formats. Stephen, is there anything in particular you wanted to highlight from this slide?
No, I think, an opportunity after this, if you're not already signed up to both receive information from Leukaemia Care or Lymphoma Action, then there's another opportunity to do that following as follow-up to the website. I think that's the main thing.
Absolutely, yeah, that will be coming into your inboxes soon. And then this slide just highlights the more support services, which I think most of which are common to both Leukaemia Care and Lymphoma Action. I wanted to highlight our counselling fund, which is open to all leukemia patients. If you are struggling to access support through your hospital, or you have been discharged or anything like that, please do get in touch, and we can help put you in touch with a counsellor who can provide that service for you. But many options depending on what support you're looking for there. And again, Stephen, is there anything you wanted to highlight from Lymphoma Action's perspective?
No, I mean, again, Jill actually mentions things like our Live Your Life for people living with and beyond lymphoma. And again, we've got both organisations got a number of different services that we deliver, but also, you know, we mentioned about doing things in collaboration. That's also something that we're doing on a fundraising level as well, particularly at this time where both of our organisations have been, you know, directly affected. And actually it's a really good opportunity. We're just coming into Blood Cancer Awareness Month as well, which starts from the 1st of September. And again, look out for various activities that we're both doing along those lines.
Absolutely, thank you for mentioning that. And I'll leave our contact details up while we say thank you and goodbye. So you can get in touch with us various methods, phone and email, and we both have WhatsApp/live chat functions on our website too. So all that remains is to say thank you very much to our panel. All of you have been wonderful. Thank you to our colleagues at Lymphoma Action for joining us on this webinar. It's been really great to work with you, and I look forward to the next one. And just in particular, Jill, thank you to you for providing the patient perspective. It's always important to hear from you guys. The final slide is just a reminder that there are plenty of other organisations out there who can offer support on various topics. And thank you, everyone. Enjoy the rest of your evening.
Thank you for inviting us to the webinar.
No problem. Thanks,
Thank you.
everyone. Bye.
Good to meet everyone.
Bye.
Bye.